Hello, everyone, and welcome back to another episode of the Medical Equipment World and Healthcare Get the Scoop, the podcast where we break down durable medical equipment, patient care, and real-world solutions for caregivers, families, and healthcare professionals. I am your host, Tara, your certified medical equipment specialist, and Silas is here today also. And we are the owners of CFS Medical Supplies and Equipment, CFS Solutions. And whether you are new to DME or a seasoned provider, this show is here to give you insight, tools, and stories that matter. Quick disclaimer though, the information shared in this podcast and any of our episodes is for educational and informational purposes only and is not intended as medical advice. Always consult with a qualified healthcare professional regarding any medical decisions or concerns for your health. Neither the host nor guests assume liability for actions taken based on content discussed in this episode or any episode on this podcast. So, I am so excited because we are here today on another topic about beds. And why do we keep talking about these beds? Because we keep getting families that unfortunately are purchasing beds and they find out they're getting these lifestyle adjustable beds that really are good beds, but they're just not clinical. Okay, they're not. The regular therapeutic beds, lifestyle adjustable beds, they're not clinical. And so today our topic is going to be not all beds are created equal. What families and caregivers need to know before buying. Okay, and so today we're going to be talking about the pros and the cons. Okay, and some of the other little different things that you would need these beds for, right? Some of the, maybe the clinical things. And just know that anytime you're making a choice, you definitely should have a clinical assessment done. What does that mean? That means that whoever you purchase the bed from, when it comes to something dealing with, your needs for different type of features, you want to make sure you go to someone who knows what questions to ask you. What's going on, your diagnoses, maybe not your diagnosis, but at least telling the person what you're dealing with. And if they're not asking you those questions about what you're doing, what's going on, is a patient a fall risk, what is your day like, these are different questions to kind of help narrow down the type of bed that you would need for yourself or your loved one. Okay, and so those are the things that we're going to be talking about today. And so while I'm having this conversation, I'm going to have Silas chime in and say something here.
Yeah, hello everyone. I'm really excited for another episode here. To talking about these beds and really just, diving more into, the pros and the cons of them because, one thing we still see that a lot of people out there really don't know what's really out there and even how to choose the right bed for their situation because a lot of it is just they don't know, right? Because, this topic is not something that's really talked about in general. So a lot of times people are just trying to just try to figure it out. And so by that happening, sometimes you do make a lot of errors. And unfortunately, in this category of beds, we know beds are very, expensive. They're not cheap. You can easily make a costly mistake that can really make things very frustrating, right? So, you buy this bed, you spend a couple $1,000s and it's still not doing what you were expecting it to do for your situation. So in this episode, we're really going to dive deep into the pros and the cons of these beds, primarily talking about 4 beds, of course, your regular therapeutic beds that we see a lot of people purchasing. Of course, the passport bed and also the Retracta bed and the active care rotation bed. So these are the 4 category of beds that we see normally that people get. And we see a noticeable difference between people who buy the proper bed and people who buy like a bed that they shouldn't have gotten, right? So I'm really excited for this episode and ready to get right into it.
All right. Awesome. Okay, so let's jump into the pros for the lifestyle adjustable beds. Well, it's comfortable. It has a great sleep system, luxury look, fits home decor, adjustable head and foot. The cons with this bed: no rails allowed, fall risk issue, no high-low or clinical functions. Okay, So that's that on that. And so some of the other things too, just to talk about when it comes to who would benefit from a lifestyle adjustable bed. People with general sleep comfort for healthy individuals, couples with no medical equipment needs, okay, mild snoring or GERD positioning without clinical risk, individuals seeking luxury or tech-based sleep systems. These beds are not for fall risk or medical patients who have a little bit, medical care or caregiver support. So lifestyle adjustable beds, they don't accommodate those things, okay? So just know that. Now we go to the passport bed. And what is the pros and the cons of that one? It's fully electric, high-low with the Trendelenburg. And I know you're probably saying, no, what is a Trendelenburg? And so that's a conversation we can have if you want to give us a call. And it has rails. It's compatible, easy caregiver access. And honestly, really, if you're comparing these two beds, it really doesn't have, I would say, a con to it, because it literally, it's just a great bed. So if you're going to compare the two, not only that, it has a luxury home aesthetic also, a built-in massage, head and leg adjustables, helps with extra comfort. It's built-in clinical high-low, as I just mentioned, with clinical features, built-in rails. And then also it helps with those with minimal mobility assistance. And it's a solid help for caregivers because it goes 42 inches high off the ground. What does that mean? That means the bed itself, the frame, adjusts high enough for the caregiver. Okay. And so the cons on that bed, which is the passport bed, doesn't come with the clinical with the chair positioning. Well, that one is not compatible because that therapeutic bed, lifestyle adjustable standard bed, doesn't do that either. And it has minimal clinical contour and minimal help for fall risk. So again, it goes back with the topic here. Not all beds are created equal. Okay, so it depends on what you have going on with you that this bed would be good. Now, what this passport bed is good for, we'll talk about some of the clinical parts of that. It's fall risk for patients. Patients needing full head and foot and height adjustments. It's great for that. It has patients requiring Trendelenburg, which is reverse Trendelenburg also. It's good for post-surgical recovery for hips and knee spinal surgeries. Caregiver friendly for safe transfers and repositioning. It has a great home environment where aesthetics matter for you, right? So if that's something you want, I want something that looks regular, and you got the people coming over like, oh man, they're in your bedroom and you can just had knee surgery. They don't even know this bed does all these things. Okay. And so that's what that's great for. And so those are the type of things that you want someone to be asking you. You want to know that this bed does all this. We call this future proofing. So where the lifestyle adjustable beds, they'll start around $2,000, and the passport bed starts around almost the same price starting. Now, mind you, by the time you get through adding on different features with these beds and things of that nature, you're going to see that these beds do increase, okay? But they're pretty much almost the same when it comes to pricing. But one has better features. More features than the other. And again, it goes back to what is going on with the patient or the person who's going to be using it. That's why it's so critical that you get a clinical assessment done. And if you're going to places and they're not asking you those questions, and some people don't need those questions asked because they don't have any of these type of things that they need to be done. So you wouldn't need to ask, they wouldn't need to ask you those questions. But if you feel like you want to future-proof your bed and it looks still the same, and those are the questions you do want to ask. If they're not asking you, you should be asking them. Okay, so what happens if I get this bed, this lifestyle adjustable bed, and then all of a sudden I hurt my knee, or I have some issues with swelling, any all those different things, right? And you need to add rails to help assist you out. You may have some back, pain going on. Will this bed allow me to add a rail to it? And see what they tell you. Right? See what they tell you. So at that point, because you want to, we say future-proof your bed. It's an investment. And so if you're going to spend that kind of money anyways, you want to make sure that you're getting one that's going to accommodate you. I always tell people, if you're about the age of 50 and up, you might want to be future-proofing your bed. Yeah, because things happen. We all, not to say that when we get 50, because I'm not gonna say how old I am, but you get these little aches and pains, and you're like, what in the world is going on? And so yeah, that's what you need to be asking these questions. If they're not asking you, you should be asking them. And so I'm gonna move on and let Silas get into the difference between the retractor and the rotation bed, and the pros and the cons, and all that's great information on even the clinical part of it.
Yeah, so just to continue on what Tara, what you're saying is, once again, all these beds are really, they're good, but just based on what's going on in your specific situation, that will really determine what features you need, and based on what features you need, that will actually dictate what kind of bed you will need to have, right? So, moving on to the RetractaBed and the active care bed, the RetractaBed is good for. Once again, the main focus with the RetractaBed is the fall risk, because one thing that, even though the passport bed is very good, and even active care rotation bed is very good, one thing is that they don't get low enough to the ground. So if someone is prone to falling out the bed, a lot of times even the passport bed is still about 20 inches off the ground. It's still still elevated off the ground. So if someone was to fall out, then they may hurt themselves, right? Now, versus with the retractor bed, it goes 9 inches off the ground. So that's pretty much flat to the floor. And so if you were effectively to roll out of the bed, then what will happen is that there wouldn't be any fall. You'll just roll out the bed, right? So there is no injury. And of course, what you can do with the retractor bed is you can always put a fall mat right next to it. And what you have effectively done is you've effectively pretty much eliminated the chances of you injuring yourself when you fall out the bed with the retractor bed, because you're basically already laying on the floor. And the excellent thing with the retractor bed too is that you're able to still achieve all the same clinical features and luxury features that you would have when it's in this elevated regular position. And also it also goes high enough off the ground so that way the caregivers can really interact with their clients. So once again, it pretty much gives you the best of both worlds, where it covers the basis of fall risk and more advanced type of clinical situations with mobility, but also it helps the caregivers and family members who are caregivers to interact with clients in the bed. And once again, it also helps with bariatric and a high weight capacity, because the retractor bed is able to hold up to 600 pounds. So that is a lot of weight, which means that this bed is very stable. So this can cover a wide range of different, clients who are of different weights. And also if someone has certain types of conditions where, maybe they're putting more weight on one side of the bed versus the other, this bed can handle that because of that high weight capacity threshold. Another thing too that the retractor bed does have as well is that it does have a stand assist. So what happens is that let's just say that this is something the passport bed also have. But with the retractor bed, once the person is, let's just say, on the edge of the bed, right, they're trying to get out, but let's say the bed is very low to the ground. Well, because of the high-low, the stand assist portion, you're now able, with the press of one button, you can actually elevate and adjust the height of the bed. So now the retractor bed acts as a stand assist, because it gets, once again, it can go very low to the ground, very low, like below a chair seat height, but also it can go very high off the ground, right? Almost as if you're in one of those, when you're in the doctor's office and in one of those high tables, right? So once again, a lot of flexibility there. A lot of flexibility. And another thing that and this is another pro of the retractor bed, is that you also have an expandable sleep surface. So once again, now this is really good if you're a person, let's say if you're a facility out there and you're dealing with multiple patients of different sizes and different needs, then the retractor bed is excellent, because you're actually able to expand the sleep surface from 36 inches up to 42 inches, which means that now you can service a wide range of different clients all at one time without having to buy multiple different kinds of beds and different frame sizes. Now, what are the cons? Well, the cons of the retractor bed is, one, it doesn't have a chair position. So once again, this is something that the active care rotation bed does have, and this is where it really excels. And also, it doesn't have some of the Some of the features that the active care rotation bed has, like the Trendelenburg, the retractor bed does not have the Trendelenburg position. Now that is something that the active care rotation bed does have, and the passport bed does have, right? So if you're someone out there and you're in a situation where the doctor tells you that you need a bed with a Trendelenburg position capability, then RetractaBed wouldn't be the best option for you, because even though it does help with fall risk and everything else, it doesn't have those specific positions. Now, another pro of the RetractaBed, before I forget, is it does still maintain that luxury home aesthetic. So once you put the covers on it, it's just like the passport bed. It looks just like a regular bed. You wouldn't even know that this is a clinical bed, especially once you put your covers and everything on it. It just looks like a regular home bed. Another thing too is that if you're wanting to have your loved one sit right next to you, then you can always get a second bed. So I would say this is probably one of the cons, is that the bed, though it goes 42 inches wide, it's still not wide enough for two occupants to remain in one bed. So which is the same as the passport bed, you would actually have to just get pretty much two beds and put them side by side, and then they can both work independently of each other. Now the excellent thing is, if you combine two 42-inch mattresses together, well, at that point you're pretty much almost at like a queen size or even a king size bed, because that's a very wide, right? So, and also very comfortable because of how they both have all these features. So those are all the pros and the cons of the retractor bed. Now getting into what application does a person have to have for the retractor bed? Well, number one, if a person is a fall risk, then the retractor bed is one of the best options out there when it comes to the fall risk, because it's able to go so low to the floor. And especially, like I was saying before, once you put that fall mat right next to it, you've pretty much eliminated falls completely. Now, if you're a person also where you need a bed that needs stronger railing, if you have a certain type of condition where you need a bed that can has a lot of different stand assist settings and has a lot of range, then I would say the retractor bed is really good for that. So pretty much the retractor bed is excellent for those who are once again, who are having different types of higher advanced medical issues and mobility needs and assistances, but also you have a clinical contour. So with the clinical contour, this is very excellent for those who have certain type of wound, issues, right? So if you have a wound, because the retractor bed is able to retract backwards, one of the main superpowers of the retractor bed is that it's also able to save space in the room. So this is very good, because now, with most beds, when you elevate the head, right, it doesn't have that clinical contour sliding motion. And so what happens is that, if you have a wound in a certain type of area, mainly on the lower back area, it can create skin shear, which will then worsen a wound, right? And so with the retractor bed, when you're adjusting the bed, it's in this sliding motion. So those targeted areas, those pressure areas are never affected. So those are pretty much all the pros and the cons of the retractor bed, and also what person it will work best for, right? So if you're someone out there and you're dealing with different wound problems, or you're at high risk of getting a wound, or you're trying to heal one, then a retractor bed is very good for that. Also, if you're a person out there where you're trying to look for a bed that can really just eliminate fall risk as much as possible, it's excellent for that. And it's very good. And also, if you're looking for a bed as well that doesn't take up too much space in the room, like you're looking for a bed that's pretty compact and pretty flexible, where you can store it away, you can move it around, because it does come with wheels, so you can always swivel and move the bed around to your liking. It just has a lot of flexibility with the retractor bed. Now, moving on to the active care rotation bed, this bed is excellent because the rotation bed, the one thing that the rotation bed has that no other bed has, that we've been talking about on this episode, from the regular therapeutic beds to the passport bed and even the retractor bed, is the full chair position. So once again, the full chair position, this particular feature on the active care rotation bed is excellent, because now now it's able to give someone their independence back and maintain their independence. And that's something that is very important, because once again, with some of these beds, if a person is starting to kind of, lose a little bit of their mobility and they need more assistance, sometimes a person may feel like they may not be at 100%, and it's kind of like a reminder when they have to constantly wait on their family member or friend or caregiver to help them out the bed, right? And so with the active care rotation bed, because you have this rotating chair feature with a built-in stand assist in that position, what you have effectively done is now you can either maintain like I said, you can maintain your mobility, or you can get it back, because now when you're rotating into a chair position, you can do everything on your own by the press of one button. And another thing too that this active care rotation bed does have is, once again, it maintains a full home aesthetic. And with the active care rotation bed, you can get this bed in 3 different models. So the fixed version of it is the version where, if you're, and this really kind of comes down to pricing, because there are those out there who, they really like that rotation feature, but they may not need anything else, right? They may not need any of some of the other features. They may not need the stand assist. And so that's, once again, goes back to that flexibility. And so because this bed is this is a very customized bed, you can choose based on what you have going on. You can choose what kind of features you want and what features you don't need. And once again, based on, what you're willing to spend, you can better achieve your goal, right? And that's one thing I really do like about the active care rotation bed. It's not like this is one bed that that you have to spend a lot of money on. It's something that's very flexible. You can choose what features you want. If you just want the rotation feature and nothing else, you don't need stand assist or anything else, then you can go with the fixed version. The standard version is like the one in the middle, so it's more affordable. It's one of the more affordable options, with maintaining all the main features that you would get in the active care rotation bed. And of course, you have the deluxe version. Now, the deluxe version is where you get a full home aesthetic. This is where you get a full bed frame home aesthetic, almost as if like you just have your regular home bed at home, right? So it has that full bed frame. But once again, it's all based on preferences, because some may not want that, right? And so the main pros, and I'm just going to read this, just kind of go down the list. So once again, like I said, it does have the luxury home aesthetic. It has the full chair position with stand assist. And in the stand assist, so you guys will know what this means. The stand assist is referring to the frame of the bed rising off the ground while you're on the edge of the bed. So the RetractaBed has the stand assist as well, but for some, the issue is that the person's not able to get in that chair position on the edge of the bed, right? So if a person's having issues getting into the chair position, getting into, where they're able to plant their feet on the side and sit on the edge of the bed, this is where the active care rotation will do all that work for you. The bed frame will literally rotate you and put you on the floor and put you in a full chair position where you're able to safely stand up and exit the bed. So that's a major pro for this bed, is that full chair position with stand assist. Another thing too is you have the head and leg adjustments. So once again, this is something that all 4 of these beds have. They all have the head and leg adjustments. So that's just a given there. This bed provides premium comfort. And so once again, going back to the Passport bed, this active care rotation bed provides the same level of comfort as your regular therapeutic beds provide and the Passport bed, because you have a great selection of different mattresses you can choose. So if you're a person out there where you want more of a firm type of feeling, you can go with a mattress that has that more firm, more responsive type of sleep surface. But if you're the person out there where you want a mattress where you just want to sink in your mattress, the rotation bed does have that option as well. So the excellent thing about the rotation bed is you can choose what kind of mattress you want. And so once again, this goes back to the pro of you can achieve that maximum comfort. And you also, similar to the RetractaBed, it does have an expandable sleep surface. Now, the difference between the RetractaBed's feature of expandable sleep surface and the active care rotation bed sleep surface is that with the RetractaBed, you can expand it at will, right? So it has these push buttons on the frame where you can, 1 minute you can expand it, you can condense it to 36 inches, and then the next minute you can expand it back out to 42 inches wide, right? Now with the active care rotation bed, it's fixed. And so what I mean by that is when you place your order with the active care rotation bed, you will have to choose up front what size you want, whether you want the 36 inch or if you want the 42 inch. Now, once again, obviously, to really maintain more of that home feeling and to make it seem like to really just maintain everything, most people just go with the 42 inch because it's a wider mattress and it just feels more like a regular home bed. And you just maintain that home aesthetic as much as possible, but while maintaining all the clinical features you would get in a hospital or in a clinical facility. And so that's one of the main keys, is you pretty much have the best of both worlds. And once again, you also have built-in bed rails, and you also have a mobility bar. Now, I just want to really kind of take my time on this side right here, because this is something that goes back to when we talked about in the beginning of this episode, is that when people come to us, a lot of times when they buy those regular, therapeutic beds, one of the main things people always complain about is that they don't come with the rail. And this is something that Tara talked about too, when she was talking about her segment on the passport bed versus the therapeutic beds, is that they don't have these rails. And so with the aftercare rotation bed and the RetractaBed, both of these beds come with a three-pointed bed rail. And what that means is that you can reposition the rail based on, to your liking. So if you want the bed rail to become more like a bed assist bar, you can. But another thing that the aftercare rotation bed does that the RetractaBed doesn't have is mobility bars. And so once again, the mobility bars are excellent because when you're in the chair position on this bed, for example, for some, though you're in the chair position and the bed is pretty much pushing you forward, you may still need a little bit more assistance once again to exit the bed fully on your own. And so with what they've done with this rotation bed is that you can get mobility bars on each side, so you put your weight and lean on those mobility bars to hold yourself up. And this is once again very excellent because the aftercare rotation bed has a weight capacity of 600 pounds. So once again, it's going to be very stable, so you can really put a lot of weight on it and really rely on it to hold you up. And so you don't have to worry about that. The bed once again does also have a clinical contour, which is the same as the RetractaBed. It has all the clinical features you would get in a regular hospital bed. And once again, like I said before, it provides independence and maintains it. And the bed is excellent for caregivers. So the only con I would say with this bed is that going back to the fall risk. So like the passport bed, it has all these amazing great features, but once again, if the person has a higher sense of fall risk and they are very prone, and that is the main thing that you want to solve, that's the main problem you want to solve, then the rotation bed, even the rotation bed, wouldn't help you in that, because though it goes low to the ground, it's not low enough to the ground because of certain type of issues like memory issues. If the person has dementia and they're constantly just rolling out the bed, then even the active care rotation bed, though it's excellent in everything it's doing, if you're a fall risk, then that's not it. You're going to still be too high off the ground, so you'll effectively fall. And the last con that this bed does have is that it is a larger bed, and primarily because it's made for a lot of different users, right? So, it's not just made for shorter clients, it's also made for people who are taller. So that goes back to why it's such a big, it is a larger size bed because of what it's doing. And another thing too, because of that rotation, you do have to have some space around the bed, so that way you can you can use those features effectively without, hurting the bed. And also it does fit in trailers, so it's not too big, because I mean there's clients out there who have used it and fit in trailers, which I don't know how they got it into a trailer, but they were able to really get into a trailer. But you do have to have some space around it, so it can't be too, so whatever room you're in, it can't be too small, because though you can still get the bed in there because it's the size of a regular bed, the problem you'll run into is that when it's time to actually get into the rotation feature, you won't have enough room to complete the rotation safely without hurting the bed. And one thing before I forget, because once again, this rotation bed has a lot of different features, and I can go on and on with some of these features, is that in the chair position, you can also use this as a reclining chair. And what I mean by that is that, you know, for example, if you're not trying to get out the bed and you just want to just, you know, kind of, you know, let's say you're in your room and, you know, you just want to watch TV. You don't want to exit the bed, but you just want to watch TV. When you're in the chair position, you still have all the different capabilities that a lift chair will have. So for example, if you want to recline all the way back and just go to sleep and take a nap, you can. On the foot section of the bed, you also have a certain section of the bed that still remains intact of the mattress, where a person or family member, a friend or caregiver can sit right next to you. You guys can both watch TV together. So once again, this becomes more of an even immersive type of situation, where this bed is not just a bed doing clinical features, but it's also giving you freedom and normalcy to whatever situation you may have going on. So now this is something that the other beds don't have. They don't have a feature where, you know, two people can sit and watch TV in the bed, right? So this is something that the rotation bed does have. Because of that chair position and the extra seat that it has next to it, you can play video games, watch TV, interact, take naps, because you can recline all the way back, elevate your legs. So basically, I would say with the rotation bed, it's pretty much a combination of a lift chair and a bed all in one, with maintaining all clinical features that you would get in a acute care, a hospital bed. And so that is something that really puts this bed so high on the totem pole. But once again, when we do the clinical assessment, based on what's going on, even this bed may not be for you, because once again, you know, it's doing a lot of different things, and to choose the right bed that's best for you, it's always good to get that clinical assessment first. So that way, based on those main key features that you need the bed to do, we can direct you in saying, look, this bed right here is good for you because it's going to do these list of things, and you can still maintain the luxury home aesthetic. And so that's pretty much it with the RetractaBed and the Active Care rotation bed. On the comparison, the pros and the cons, there aren't really too many. Most of these beds have a lot of pros, because once again, they've been engineered to maintain a wide range of different clients with different higher mobility assistances, right? So they're not going to have a lot of drawbacks when it comes to that, and they still maintain a full home aesthetic. Once again, the password bed is excellent as well, and I would say the only drawback is that only one occupant can be in one bed. But once again, you can just buy a second one, and then you can put two beds together, and now it becomes like a Cow King.
Awesome. Yeah, great. Oh my gosh, that was awesome, Silas. Thank you so much for breaking that down. And I hope that this has been a huge help for someone out there. I know we get quite a few calls. My goodness, we get it all. We say boots on the ground, literally, because it's so sad when we get, clients. Well, they're not technically clients of ours at that time. They're just reaching out to find information out to see what they can do, about the bed they have, or can they add rails? Can they add this feature, that feature? And unfortunately, we have to tell them, most of the time it's no, because they got those regular therapeutic type beds and lifestyle. And again, it's not that those aren't good beds. Those are great beds too, but it just depends on what's going on with you or your loved one. So again, you're listening to the Medical Equipment World and Healthcare Get the Scoop. And our topic today was not all beds are created equal. What caregivers and families need to know before buying. So I hope you have enjoyed this episode, and I hope that when you listen to it, you can take something from it and make a great decision with your healthcare journey. Thank you for listening in. And if you have any questions, please go to www.cfs, that's Charlie Frank Sam, medicalequipment.com, or www.cfssolutionsdbs.com. And with that said, I'm going to let Silas go ahead and do his ending and closing remarks, and we're going to close out tonight.
And yeah, so my closing remarks is just to summarize everything that we talked about today. I would say when it comes to the regular therapeutic bed, once again, like Tara said earlier, it's great for those of you out there who are having no issues at all. If you're just someone saying, look, I just want a bed that just does a little bit more, but I have nothing going on with me, then the therapeutic bed is a great option. If you're someone out there, you have some certain type of mobility assistance issues or anything like that, then I would say the Passport bed is excellent. If you have a family member out there and they're dealing with a fall risk, and you're going through multiple caregivers, and caregivers are complaining to you about they're falling again, or it's not high enough, all those different things, then the RetractaBed is excellent for that. And once again, if you want a bed that can pretty much do a little bit of everything for you while maintaining a full home sec, and they can give you a full independence, your independence back, and maintain your independence, then that's when I would tell you just to go with the active care rotation bed. And you can reach out to us if you have any more questions. Like Tara said, you can reach out to us at 310-817-5373. We do clinical consultations, and we'll pretty much just ask you, this list of different things that are going on, and based on those things, then we'll just point you to what bed will best help you.
All right. With that said, thank you for listening in, and we'll see you on the next episode.